Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Don't forget to subscribe so you don't miss any future episodes. Please leave a review or a rating if you love the show. It really means a lot to me and it helps get the show out to more people. My grief tip for today is something that we have talked about in so many of these episodes, but I feel is worth repeating. Please, please find a support system. This can be anyone you feel safe talking to about your loss. A friend, family member, a health professional, even the online loss community. Sometimes it's nice being able to talk to a professional or someone online because you're able to talk to a neutral party who doesn't really know anything about you. And for some, this makes it easier to open up. For others, they feel more comfortable talking to a trusted person they are already familiar with. And I know so many of us think that we can do this alone or that we need to do it alone, but I promise you don't. There's no reason for you to try to do it alone. Let people support you. Let people help you realize that you aren't alone, that you're not the only one who has gone through this heartbreaking loss, and that what you are feeling or thinking is normal and that they understand. It may feel hard to open up, but from my experience, it's so much better knowing you have people on your side that support you and love you. Today I am talking with Katie. She was a registered nurse who worked labor and delivery and postpartum and is now a childbirth and nutrition educator. Katie had a miscarriage, a chemical pregnancy, and the loss of her twins on her journey to motherhood. She has 2 living children, one of which required a NICU stay. Hello, everyone. Today I am here with Katie. Katie, can you tell us a little bit about yourself?
Hi, yeah. So my name's Katie Robinson. I'm a registered nurse and I worked labor and delivery and postpartum. And now I work in like a doctor's office on the phone triage girl. And I also am a childbirth educator and am starting to focus on nutrition when it comes to um, everything like pregnancy related. So trying to conceive, prenatal, postpartum, and with loss as well. And then I'm also a mom. I have 2 boys and they are 10 and almost 8. Um, yeah, so that's kind of my resume of me as a person, I would say.
Well, first of all, thank you so much for the work you do as a nurse and that you have done. The labor and delivery nurses that I had with all of my births, they are like the best people. So I love you guys.
Yeah, it's very sweet. Yeah, I do miss it, but it was just time to pivot into something else. And so here I am. And it's exciting to focus more on like the before you get to the hospital, and try to make a difference before we're actually in labor or in the throes of whatever brought you to the hospital. So I am enjoying this, but I loved being at the bedside for birth. It was amazing. Yes.
So can you talk a little bit about your lost journey?
Yeah. So my journey into motherhood wasn't like straight and arrow. I mentioned I have a 10-year-old. So we're talking 10 plus years ago. So it's been a little while. But I was freshly married, and in my head, in my mind, I was like, I want to have a baby right away. And that's not how it happened. It took a while to get pregnant. It was like probably like 6 to 8 months, which is, still within the normal range. But in my 22-year-old brain, that felt like a very long time. And then, yeah, we got pregnant. And then I found out I started like cramping and spotting. I was about 7 to 8 weeks along, probably. And then I went in and got the HCG levels, the labs, and saw that those labs were falling. And they told me, this is not a viable pregnancy. And then the bleeding and the cramping just kind of progressed from there. And I had my first miscarriage. And I had not, I mean, I was the first one in my family of my friends to have babies. So I didn't really know anyone that had been through that. Um, my mom and my grandma and cousins and stuff, they had never had a miscarriage. So um it was pretty difficult. I wasn't prepared at all for it. And I had already shared the news with like my whole family and work and the whole thing. Um, so I had to figure out how to manage that after. Um, and so yeah, it was pretty rough. My husband was he's a very good man. I love him, but he's not the most emotionally apt person, like so he was kind of at a loss. I know it was difficult for him because he just wanted to fix it and there's nothing they can do to fix it. So
Right.
but he was there for me in his own way.
They
um
try.
yeah, they try their hardest. So yeah, I just remember being very emotional and, you know, calling my mom and being like, can you tell everyone? And then my family, because they weren't super experienced with it, they oftentimes don't know the right thing to say. I say that in quotes. So they didn't really know what to say or do. But anyways, so that was my first one. And then decided after that one, I was like, let's move forward and try to conceive again. And I got pregnant relatively soon after that miscarriage. And then that one was a chemical pregnancy. I got the positive. I was excited for like a couple of days, and then all of a sudden I wasn't feeling the breast tenderness. I just felt different, and I retook a pregnancy test and it was negative, and then shortly after started bleeding. But it was, people always think like with a chemical pregnancy, it's not as big of a deal. And, physically, it's not. But I had just been through a loss. So it was like just compounding those feelings. And then these fears of like, well, maybe I'm not going to be able to have babies. Why did this happen again? Is there something wrong with me? Um, just your mind starts kind of spiraling in those kind of situations. um, so yeah, that was difficult once more. um, and I forgot to mention, during this whole phase of my life I was in therapy, just kind of as a person, going to therapy and working on myself. Um, And so that was really helpful to have someone kind of unbiased that I could talk to through this. And then she gave me some like great advice, like, why don't you write a letter to your baby and, um, you know, introduce yourself or express how you feel about them, name them, do whatever feels right for you. So I do have those letters, like I wrote them in my journal. And I always find that to be special to kind of reflect back on and remember that they're part of my family as well, as brief as it was, but that it was real, and they are real. And yeah, that did help with I think that did help with my healing, um, to have someone that knew what the right thing to say was. So that was helpful.
I love that idea.
Yeah, and I do, when I hear other people's stories, it's not one right way of doing that, but I do think it's helpful to honor your baby in some way, whatever that looks like. Is it planting something in your yard, or writing a letter, or whatever that is for you. Okay, so then after that pregnancy, we were like, we're getting back on this wagon here. Let's try again. And I got pregnant after, I think it was like another 6 months or so. And that one, he stuck around. I was violently ill with him for most of my pregnancy. So I had a lot of nausea and vomiting, which was difficult, but also reassuring that this was, going to be viable. And yeah, I was so happy and relieved that I was pregnant and it was happening. Um, but physically, I was a hot mess. I did not feel good, and I had a lot of pain in that pregnancy. And I don't know if I was like totally healed emotionally from what we had been going through. So I was very anxious. I was the patient calling the doctor's office all the time. That was me. And so I was going through a lot. And it made things a little bit more challenging for that pregnancy, but I'm so grateful, right, that I have him. And he just turned 10 years old. His name's Wyatt, and he's getting to be a big boy. Um, and we definitely have a special bond, the two of us, the one that made me a mama. Um, and yeah, so there's that was him. And then after like a year and a half, I was like, okay, if I get, I'm a planner. I was like, if I get pregnant now or soon, then they'll be this far apart. I wanted them to be closer in age. So we started trying again, and I got pregnant after about 6 months or so. And with that one, it was different in that it seemed to be progressing. I wasn't super sick, but I got that positive test and wasn't bleeding, and just made my first appointment. And I went in for my first appointment around 9.5 weeks, and they did an ultrasound. And the first thing that they said, and it was my doctor doing the ultrasound. This was a small town clinic. Um, and the first thing she said was, "Oh, there's two." And I remember I started panicking. I was like, I cannot, I can't, I don't think I can do this. Like, I don't think I am capable of having twins. I don't want this. My mind just like, there was a lot of negativity happening. And then there was silence on the other end from my doctor, not much. She was just very quiet as she was looking, as I'm freaking out, trying not to have a panic attack. And then the next thing she says was, "But there aren't any heartbeats." And they were measuring like 8 weeks or so. So that was really challenging because I had a lot of conflicting feelings, like I had a lot of guilt. Like, did I wish this upon myself? Like I immediately was like, I can't do this. I don't want to do this. And then the next words are that, they're not viable. And so that's hard, to process, because to be perfectly honest, part of me was a little bit relieved, um, because I was scared to have twins, even though I know many people have twins and do fine with it, but it was like a fear of mine. But then I was also completely devastated, and scared, and like what's going to happen? I'm going to go through all of this all over again. Maybe I won't have another baby, all of those thoughts. Um, and then it was also more complicated in that I wasn't bleeding. There was no indication that I was going to start bleeding. I wasn't, everything had appeared to be going smoothly. Um, and so I opted to have a DNC, to, the procedure to help with that process. And it was relatively quick. I think later on, like it was within the same week that I had my procedure. And that's another interesting situation because I worked at that hospital I worked with that physician and at that hospital. So, and just being a nurse, and being the one that is usually the caregiver and then coming in wearing a gown and being very vulnerable. I'm there because I'm here for a miscarriage and naked, in front of people that I work with. It was just a very strange, like I can like smell the OR, I can see it just kind of imprinted in me that moment of walking into the OR and the anesthesiologist counting down and just feeling like an out of body experience. And then after the procedure, I was in the recovery area and I was waking up and it just seemed very fast. Like it was like, oh, you're awake. It's time for you to go, And they checked my pad and made sure I wasn't bleeding excessively. But as soon as I stood up, I had a large gush of bleeding and there was like blood all over the floor. And it was like, oh, that's normal. Let's clean you up, slap a pad on, get you in the wheelchair, you're out of here, And like looking back, it probably was normal, like I help people through these kinds of things all the time, talking them through it. Um, but when you're going through it, it doesn't feel normal. Like I was like, whoa, that's a lot of blood. And
Right.
then it in front of my husband, like my husband's standing right there and we're close, but I mean, I don't show him my period blood. You know what I mean?
Right.
So it was a little bit like I felt almost like embarrassed or I don't know, like, oh gosh, I
Like,
can't
didn't
believe,
want you to see that really. Yeah.
yeah, like I don't know. And some couples are very much more open, but we're not in that kind of way, So anyways, that was strange. And then um yeah, so then I just went home and I remember the bleeding did slow down and everything was fine, but I remember being really uncomfortable with cramping the rest of the day and just kind of huddled down, hunkered down and with a heating pad and ibuprofen and I believe my mother-in-law took my little one for the day. Um, but that was incredibly difficult. I mean, that whole process, all of them were difficult, but that one especially was very emotional for me. Just, I think, with everything that had happened. I remember when they told us, after the ultrasound and we're leaving the appointment, and I'm trying to like kind of act professional in front of the doctor that I work with, like all business, like, oh, okay, like I understand. Yep. Follow up. Yep. I'll call you when I decide what I want to do. Very like flat. And then as soon as we like stepped into the parking lot, I like physically just like crumpled. I just started sobbing loudly, very like aggressively sobbing, um, right there in the middle of the parking lot. And my husband was just like holding me up, and that's another one of those moments that just will stay with me forever. It was a very hard time. Um, Makes me emotional even thinking about it. So, so yeah, so that was that process. And I then we decided after I healed from that, it was let's try again. And I got pregnant very soon after that. I had one regular cycle and then got pregnant the next cycle. And and then that's my Carter. He's almost 8. And that was interesting because the pregnancy was completely different than my pregnancy with Wyatt, in that I wasn't very sick. I think I puked one time in that pregnancy versus like the hundreds of times I puked with Wyatt. So there was that. But then we also discovered that I had a placenta previa with that. So my placenta was near or covering the cervix at different points in the pregnancy. And so it was complicated because I was having that often resolves. It moves up and then everything's hunky-dory. But mine, I was just a case where it didn't. It moved further down and covered the cervix completely. And so as that my pregnancy progressed, and it wasn't going away, it was like, okay, now we need to start talking about a C-section, because you can't deliver vaginally with that condition. And then it was complicated with bleeding episodes. So I had 3 different bleeding episodes, um, and which ultimately there was a couple of like overnight stays in the hospital to monitor me. And then at 36 weeks, I had my largest bleeding episode. And then it was like, okay, you're 36 weeks, close to term, these keep happening, and this is your biggest one yet. But they opted to do the C-section a little bit early. So he was born a little bit early. He was in the NICU for 5 days. And I had a C-section. So it was definitely a challenging recovery because he was in the NICU, and I was physically recovering from major abdominal surgery. So but what was interesting when I like started researching placenta previas, and I'm a nurse, I knew what it was, but when I started like digging deeper, the more uterine surgeries you have, the more likely you are to have a placenta previa. So with me just recently having a D&C, who knows, that might have influenced the pregnancy implanting lower in my pregnancy, because where the previous pregnancy was may have still been healing or have scar tissue. And so the new pregnancy couldn't implant there. But you never know. I mean, I can't look inside my uterus 8 years ago. So it's like, why do
But
I
I
even think
understand
about
wanting
that?
to do the research, and I
Yeah,
like
you
to do
start
that
like
too.
digging, and then you're like, why am I even doing this? Like, it's not going to change anything. But and then I'm like, well, would that have changed my decision? If I would have known that, would I have waited and done more like expectant management and seen if my body would have passed the pregnancy on its own? Or would I have still done the D&C? I don't know. Who knows?
I don't know why we do these
I
things, but
don't
I
know.
do the same thing where I'm like, what would I have been different? What if I had done this differently? And I'm like, what? It doesn't matter. This
It
is how
doesn't
it
matter.
happened.
Yeah, here I am today, and it does not matter. Um, so yeah, so that would be my full story of my how my I came to be with my 2 sons and 2 miscarriages and 1 chemical pregnancy.
Well, thank you so much for sharing that.
Yeah.
Did they ever find a reason for your losses?
No, I never. We decided we didn't want more children. After a road like that and like the difficulties with my pregnancies, I was just not a happy camper being pregnant. So, um, I didn't have like a need to find out, right? Like technically they say like 3 or more miscarriages would be like recurrent pregnancy loss or reasons to like work you up for a why. Um, But at that point, I was like, I don't want another baby at this time. So it just, I didn't pursue it.
That makes sense.
Yeah.
So were you
Uh,
doing, oh, go
Oh,
ahead.
sorry. No, I was just gonna say, but I've always been curious, but I don't know.
Yeah, no, I understand. It's one of those things like, I mean, it would be kind of nice to know, but there isn't, you don't really need to, right? Since you're,
Right.
so it's like,
Yeah.
then do you really want to go through all the testing or, or what would it solve, I guess?
Right. Exactly. I do not know.
So were you still doing the labor and delivery like throughout all of your losses?
Yes, I worked labor and delivery through all of it. And then we moved to Idaho when Carter was 3. So that's when I kind of pivoted into outpatient setting when he was probably like 4-ish, I would say. So yeah, through that whole journey, I worked labor and delivery. So that was another challenge, as you can imagine, working side by side with women going through having their babies and then caring for people having their babies. And I mean, I took a little bit of time off of work for each one, so that it wasn't like I was still actively bleeding, but obviously you don't recover emotionally from a miscarriage as soon as you stop bleeding, right? So I still was, it was still challenging. I'm kind of a compartmentalizer in many ways, so I would be able to like, it wasn't like I was like crying at work, you know, it was like, I'm going to focus on my job while I'm here and care for these people and the best that I can, and then maybe on the cry ride home, there might be a few tears,
Yeah.
especially in those situations. This is, I don't even know if I should say this, but in those situations where it's like, where people are having babies that, in my opinion, maybe shouldn't at that time in their life. You know what I mean? Like these rough scenarios. And I'm like, if only I could have a baby, right now. And this person just, you know, has one at the drop of a hat. And this baby's not probably not the best environment for this baby. So
I think
uh
all of us that have had loss or infertility issues, I think we've all had that thought.
yeah, exactly. It's a tough thing to wrap your mind around. Um, and then what I think was honestly, instead of like the patients I was caring for, what was most difficult for me was my peers. So like I work when you work at nursing, you mostly work with women, right? And we were all many of them are in the same age bracket as me and our having babies stage of life. And so I just remember like people getting pregnant, and maybe it was like the same time. I remember specifically with the twins, um, another coworker getting pregnant at the same time. And then my loss. But every time she talked about her baby, I imagined my babies being that age, even though I had a baby like shortly after that, like it's still like every single time she talked about her kid, it brought up, oh yeah, that was we got pregnant at the same time, but my pregnancy, obviously didn't go forward. So it was just this like constant like picking at a wound, every time. And obviously wasn't her fault. It wasn't like I was mad at her or anything.
Right.
It just brought up those emotions each time. And so, yeah, that was challenging. And yeah, especially, and then like when you were trying to conceive and then other people are announcing that they're pregnant, which I'm sure many of your listeners can relate to how challenging that is. Um, and then like family always asking, like completely oblivious or unaware of what you've that you recently had a miscarriage, and they're like, when are you going to have another? Like those
Like,
things.
please
And
stop asking.
yeah, like how about just shut up? But
Like, I'll tell you when, okay?
but it's just like they just completely like it was coming from a place of love and interest, but it still was hurtful, you know. Um, but yeah, it's a little bit easier to reflect on those things now. But when I was in it, I remember how painful it was.
Yeah, I actually knew somebody, a similar situation, a friend who was pregnant at the same time as me. And then I had a loss and she had her baby. And so I was the same as you. Like every time I'm like, well, I should have a baby at that age. It's
Yeah,
hard.
it is.
Even if it was an early loss, it doesn't matter. It's still hard.
Yeah, because the moment, I mean, the moment you start trying to have a baby, you're already imagining, what they're going to be and who they're going to be, what they're going to look like, how old are they going to be. I mean, you're already um, bonding with this
Right.
little person. So yeah, it was it was hard.
And so now you're doing more of the prenatal type stuff, like the
Yeah,
nutrition and things like that.
I just completed a training. I don't have my certificate quite yet. It's coming in the mail soon. But just finished all like the classwork for a professional prenatal nutrition program. And they cover, the trying to conceive, fertility, loss, all trimesters of pregnancy and postpartum. Um, so that I can provide more. I just feel like that's a big gap we have in medicine, and in care for women. It's often just eat healthy and try to eat whole foods and not much more. I know in fertility, in that kind of section of the pie, sometimes there's more guidance in that, but sometimes there isn't. And then for the rest of that pie, there's usually not much guidance. Um, and I know because I'm the person that, as a nurse, was trying to provide this information for people. And I was trying to eat lots of fresh fruits and vegetables and eat lots of whole foods and make sure you take your prenatal vitamin. And that was basically, I didn't have enough past that to give people like solid information. Um, I would get questions and then I would just Google it, and try to figure out the best source of information to guidance for them. So I knew, this is a major gap, and I would hear other moms talking about it and asking questions. And a lot of questions I would get at my office job many times was, is this safe to eat? Can I eat this? And so I just knew that this is something that I wanted to be able to provide more guidance on for women trying to have a baby, just had a baby, or pregnant, or going through a loss. And I feel like, especially going through a loss, that's usually not addressed much at all. It's just, more focused on emotionally healing and kind of, like I said, hunkering down with a heating pad and ibuprofen and getting through it. But in this class, I learned that their nutrition can support you while you're going through a loss, even if it's an early loss or maybe a little bit further along.
I think you're right too, that so many times, we're just told, don't eat this, but then you're not really told what to eat. It's like,
Right.
oh, okay, well, yeah, you can
Right.
tell me to eat healthy, but what does eat healthy mean?
Right, exactly. And many people don't know, and I mean, I just imagine a bunch of like vegetables sitting on a table, but when I sit down to eat dinner, am I just eating a bunch of vegetables just sitting there? Like, no, like how do I how do I shop? How do I prepare? How do I cook foods that are quote unquote healthy, but also will support whatever I'm going through during that, pregnancy? So like, am I really nauseous? Can I just not even tolerate looking at chicken? Like how do I work around these little speed bumps that come up in pregnancy, but also get optimal nutrition and optimal results for you and the baby. Um, yeah, so that's my goal, is to provide more of that info for people.
I think that's great. I mean, I agree that there's definitely a gap there that, we're not really taught much about diet. And I know, like for me, I have PCOS, and
Mhm.
PCOS diet can do a lot for PCOS. No
Right.
one ever told me that.
No, they don't. It's so interesting to me. Like, it's like, here's birth control, like here's a
Hmm.
pill to take. Um, and that's usually the extent of it, as what I've noticed. And so, yeah, it's not saying that birth control can't be helpful, but also like we can look at, they can be more of a collaborative effort, like it can be medicine and nutrition, or maybe let's start with these like nutritional changes and maybe you don't need medicine. um yeah, so
Yeah, I definitely agree. And sometimes I think people just look for I mean, I don't want to say like easy way, but like,
mhm,
sometimes it's like, oh, I'd rather just take a pill than learn how to
right.
like redo my diet.
And many people don't, I mean, and diet is something that is really hard to change in people. These like behavioral changes around food are really difficult. And so, I mean, I can see why, but if you're very motivated, and usually in this stage of our life, that's usually when we are the most motivated to make behavioral changes, because we want to get pregnant, or we are pregnant and we want the best for our baby. And so it's a great window of time to make some lifestyle changes that could benefit all of those things, but also like your health as just a human as well. A lot of those changes might stick around after you're done having babies. So
I know for me, like when I was first looking up like the PCOS diet, I'm like, okay, it's like taking away everything. It's like no sugar, no gluten, no dairy, I'm like, well, what can you eat?
I
you know?
know.
And I agree though, like if I had known about that more like during the time I was struggling to get pregnant, I would have been on board to like make those changes a lot sooner.
Right. Yeah, exactly. And then um especially when it's just like a fire hose of like, you need to make all of these changes, like all of these changes are super duper important for your health and to get pregnant or for the pregnancy. And sometimes it's so much that it might cause somebody to kind of shut down, like, well, that's impossible, there's no way I can change that much how I eat, like, then I'm not even going to try. So instead, like, choosing one thing to change at a time, and just these small little gradual changes. And even if it's just you only change that one thing, that it's at least that's still impactful. It doesn't have to be all or nothing. Every little thing can be beneficial. So I don't, it's just, I know how it can be very overwhelming.
It
So
definitely can, and
yeah, and
especially if
you're
you're
like,
used to eating a certain way.
right. And that's kind of how my mindset is usually, is like, there ain't no way. Like, there's no way I can do that. It's too overwhelming that I'm not even going to try. So when I was doing this class, I'm not really in this window. I'm not trying to have a baby. I'm not pregnant. I'm not postpartum, but I'm still a woman, and I'm still a human. And many of these things are just for optimal health, and to reduce inflammation. Like, yeah, I would like to reduce inflammation even if I'm not pregnant,
Right,
So,
right.
so I started making some of these little changes that I wasn't doing before, because I wasn't aware or how to do it. Like, how do I actually cook this or make it yummy where I want to eat it, or where I feel good enough after that it motivates me to continue doing that. And so, yeah, I've just been doing small little things. It's not like I stopped going to Starbucks cold turkey. I just also added in a lot more home cooked meals from home and lots of produce, really. So, yeah.
I know that there can be, a lot of different things that people can change in their diet, but are there like a couple of things that you think, people should focus on first, like in changing?
Um, like if you're trying to get pregnant
Yes, sorry,
or
if you're trying to get pregnant.
yeah. So for that, I would say the main thing would be if most people have some deficiencies, like micronutrient deficiencies, right? Like vitamin D or magnesium or selenium and these, and you might not know exactly which ones you're deficient in, but we know like from research that many people are deficient in these nutrients. And so trying to include more foods that have those nutrients really by eating more vegetables and fruit is the easiest way to do that. And then that's going to increase your stores of it. So if you have extra, it's not like you just get rid of it, your body stores it. And then if you're deficient in it, then sometimes your body is like, we don't have enough to go around to have a pregnancy right now, if you have multiple deficiencies. So if you have extra, that's like a welcome sign, like, yes, we are ready for a visitor. We can take care of this fetus. So there's that. And then also blood sugar balancing is a big one. And this is really like it's having a moment in Instagram and lots of people are talking about this, right?
Mm-hmm.
But it's there's a lot of validity to it. So if we have these big spikes in our blood sugar and then these quick falls after the spikes, and it's this like jagged timeline of what our blood sugar is doing, that over time increases inflammation in the body. It over time, chronically, that's going to lead to insulin resistance and then higher blood sugars and more inflammation, which will make things, including your ovaries and your eggs and your egg health, right? So trying to have less of those big spikes in your diet. And the way to do that is to try to eat more of a, like we call it, balancing blood sugar diet. So, reducing, you don't have to eliminate, but reducing a lot of those like refined carbs and dessert-y and sodas. And there's a lot of simple sugars in sauces and condiments and things like that. And just being a little bit more intentional with that, looking at the label, like barbecue sauce and ketchup and stuff like that. And then trying to include more protein, fat, and fiber in each meal. And that's going to keep the blood sugar, when it rises, it's going to look more like a plateau and not this peak. And so that's over time, we're going to see less inflammation. And if your body has a lot of inflammation in it, again, it's like the welcome sign is not up. Your body is not ready for a baby. And sometimes it still happens. It's just if you're already struggling to get pregnant, then that's something to definitely consider, is trying to eat more whole foods and if you're going to have a cookie, have it with your dinner, so that you can have it with that protein, fat, and fiber and reduce those big giant spikes in your blood
Thank you.
sugar.
That's all really helpful information. I love hearing about nutrition stuff. It's what I wanted to do originally
Oh,
when I was going
really?
to school, but then I was like, oh my gosh, there's so much science.
Yeah, there is. I know. And I'm not a registered dietitian. I'm a nurse. I do have that medical background, and this is just like supplemental. So none of this is like a prescription for an individual person, right? Like what a dietitian can do, but it's all just education and like coaching and guidance. is usually applicable to most people, right? Like this is pretty broad that we can say this is good for most people to eat more
Right.
like this, but yeah, lots of little tricks that she taught us. It's Lindsay Taylor was the teacher. She's the food doula on Instagram. She's a great one to follow if you're trying to get pregnant or pregnant. If you're looking for some nutritional guidance, you can also follow myself as well. um, but yeah, lots of little tips and tricks like that. And just looking at your plate and dividing it into quarters, right? And so a quarter of your plate being protein, and then another quarter being some more complex carbs, if you can, made from whole grains, or maybe some like potato, or with the skin on it, things like that. And then the other half of your plate being fruits and vegetables. And then don't forget your fat, which is sometimes included with the protein. But if it isn't, do you have a sauce or a dressing or something, or avocado, something that you're going to put on there with fat as well?
I think
That,
sometimes fat
I
gets
know.
the
I was just
bad
going
name.
to
Like, you
say,
can't eat fat.
yeah, exactly. And that was a big way that I grew up hearing grown-ups talking about, like, oh, fat, everything's low fat, or margarine, or low fat milk, low fat yogurt, all those things. But a lot of those low fat products have added sugar in them to make them taste um edible. so, so so sometimes, yeah, it's not always like counting calories. Like fat, you're going to have more calories, but fat's really good for you in many ways, like our cholesterol, it is what makes hormones. So we need fat to have good hormone health. We need fat for babies' development, especially their brain. So if you're trying to get pregnant, if you're trying to stay pregnant, if you're trying to make a healthy baby, and also for blood sugar balancing, if we have a well balance of all of those macronutrients, that's going to help keep that blood sugar stable and not these big giant spikes and plummets.
Yeah, that's it's all like, it seems like such a simple thing, but it's not. I mean,
I know it seems simple, but then you're like, well, how do I actually eat like that? So I mean, I can tell you from experience, it's been having something to kind of guide me along the way, a cookbook, a good cookbook that has a lot of these recipes in it, and you kind of cook your way through some of it, and then you just kind of start cooking like that, where you don't need a recipe, right? Okay, to make a good dressing, I need some fat, I need some acid and some spices, and you just do it. You don't need somebody telling you exactly how to do it. Like for instance, with the food doula cookbook that I've been cooking a lot out of, and then I I was like, okay, I'm gonna make some lunches for work. And I was getting kind of like, I eat so much meat, but I also need protein to keep me full. I can't just eat a salad and be full at work the whole day, right?
right.
so so like I did a cold bean salad. So I did black beans and chickpeas, which have a lot of protein and fiber, and carbs in it. But with that fiber, that's good. That's a good carb to eat, right? It's got a lot of protein and fiber with it. And then I did chopped bell pepper, chopped tomato, a little bit of jalapeno. What else did I put in there? Onion. And then I did some cotija, is that how you say it?
I'm
Cheese,
not sure, but I know what you're talking
the
about.
crumbly cheese, the
Yeah.
Mexican food restaurants. I love that texture. And then I did a dressing with uh, some olive oil, apple cider vinegar and then lime juice and cilantro and like just blended it up. Oh, and then I had quinoa in it as well. So lots of protein, lots of fiber, and kept me full the whole day, the whole rest of the day. And it was so citrusy and bright and crunchy, so much textures. Um, and it's gonna last. I made a big batch. Like I made enough. It's not like I'm gonna cook like that every day, right?
Right.
I'm gonna do this and make a bunch of it and eat it for a few days and then make something else and kind of do it that way. Otherwise, it's not doable for me. I'm not a stay-at-home mom. And many stay-at-home moms can't do that either. You know what I mean? Like it's just we're busy. We're busy people. So it's just thinking ahead like that. And um, yeah, I was pretty proud of my little dish.
It sounds amazing.
And it was delicious and it didn't have any meat. And usually I'm a meat person. Like everything has to have a meat if it's not breakfast. And so I was kind of challenging myself in a way, like how can I make this meatless and still check all the boxes, you know? So yeah, that would be a great option for someone trying to get pregnant and wanting to make these changes. And you mentioned PCOS, and that makes sometimes trying to conceive more challenging. But also with PCOS, you kind of alluded to that. There's usually built-in insulin resistance with that. So this is even more, something to kind of have in the back of your brain, and something to explore is how can I make these little changes to help myself out, with this blood sugar business.
Yeah, I think that's great advice. And now I really want to go try to make a salad like that. Because when I think of when I think of salad, you just think of like the basic salad. Like here's some lettuce,
Right.
maybe some shredded cabbage or
Yeah.
carrot or something. And it's like, that's not filling.
No, no. And I'm a big texture person. Like I have to enjoy it. Otherwise, I'm not going to pull that out of the fridge and eat it. And if
Mhm.
it's just like this like limp, soggy thing,
Yeah, I'm like, no.
no,
It
it's
will
not
just
gonna
stay in the
happen.
fridge.
Yeah, exactly. So I was like, I want something that's got a lot of crunch because that will make me enjoy it and be very citrusy and bright and flavorful. Because a lot of times I think of like black beans and chickpeas and they're kind of bland tasting,
Mhm.
And I was like, no, I'm going to put a ton of lime juice in this. And it worked. It was really good.
So do you have an Instagram or anything for people to follow you?
Yes, I'm at Katie's Childbirth Ed. That's probably the easiest way to find me and contact me. I also have a website as well, but that's all on my Instagram. Um, and then email is katieschildbirthed@gmail.com. And yeah, I'm planning on having more nutrition content, not just labor and birth, but also putting in nutrition and offering nutrition coaching for pregnancy and postpartum and for conception.
Sounds like a lot of exciting things.
Yeah, I'm excited.
Well, I want to thank you so much for coming on today and sharing your story and some great nutrition tips.
Yeah, thanks, Sarah. Thank you so much for offering this for your listeners and for having me on.
Thank you so much, Katie, for sharing your story with us. I think stories like yours are common, though not always talked about, where people go through recurrent losses and they're all different types of loss, like people who have a miscarriage, an ectopic pregnancy, and a stillbirth. And it can just feel so isolating, like you're the only one who keeps having loss after loss. And when there are different kinds of losses like this, it makes doctors not always take it seriously. Some doctors will do testing after 3 losses regardless, but some will only do it if you've had 3 of the same type of loss. And when you have different types of loss for different reasons, you can honestly just feel like the universe is against you. It can feel impossible that you will ever bring a baby home. And it makes you question, why is this happening to me? It brings up all the feelings of guilt and of not feeling good enough. It can make you feel as though you aren't worthy of being a mother. And I know it is so hard to push away these feelings. We are constantly feeling like we aren't good enough in different areas of our lives. And the journey to motherhood is no different. But I promise, you didn't deserve any of this happening to you. You are worthy of being a mother. And you are a mother to your babies. So please find a doctor that will take you seriously, that will listen to you and not treat your losses all as unrelated flukes. You deserve answers, and you deserve a chance at bringing your baby home. Voice your concerns. Keep switching doctors until one will listen to you. Try to keep that trust in your body, as hard as it can be. Try to keep the trust in yourself. And finally, try to keep loving yourself. It's so hard after loss to not feel angry at ourselves. But use the advice Katie gave to help nurture yourself and your body, because you deserve it. Don't forget to subscribe so you don't miss any future episodes. Please leave a review or a rating if you love the show. Thank you so much for tuning in, and remember, we are all in this together.